Welcome, everyone, to another JPN and Ematai Grand Round session. Before we begin, a special thank you to Rabbi Shlomo Brody from Ematai and to Chemed Health for making the CME accredited Grand Rounds possible. It's an immense honor to introduce our distinguished presenter for today's session, Rabbi Dr.Avraham Steinberg. Rabbi Steinberg is a recipient of the prestigious Israel Prize for Original Rabbinic Literature for a 7-volume encyclopedia, the Encyclopedia of Jewish Medical Ethics. Simply listing and describing Rabbi Steinberg's contributions to Jewish scholarship and medicine perhaps deserves a talk for its own. But just to share some relevant highlights today for our audience, Rabbi Steinberg is the Director of Medical Ethics Unit at Shaare Zedek Medical Center, co-chairman of the Israel National Council of Bioethics, and head of the editorial board for Encyclopedia Talmudit. He's written and edited over 46 books and well over 300 papers and chapters in Israeli and international medical journals. Especially relevant to our talk today, he's a member of the Israeli Chief Rabbinic Committee on matters related to the dead, as well as the medical ethics advisor to the Knesset. In today's talk, Rabbi Steinberg will guide us through the halachic perspectives on the moment of death and organ donation, a subject that touches on ethical, medical, and spiritual dimensions of life's final chapter. This topic is both personal and important. As such, we encourage listener involvement. Please share your questions and insights on the Zoom chat, where JPN and Ematai board member Dr. Jonah Rubin, an attending physician in the Division of Pulmonary Critical Care Medicine at Massachusetts General Hospital and Harvard Medical School, will moderate a question and answer session at the end of today's talk. Without any further ado, Rabbi Dr. Professor Avraham Steinberg.
Thank you very much, and thank you for giving me the opportunity to share with the audience some of the issues related to the definition of the moment of death and organ transplantation. As I assume you know, but I'll develop it a little further during the talk, they are very much interconnected. Organ transplantation of many of the organs that we do today are dependent on the definition of the moment of death, and that by itself is a debatable issue in halacha, less so in ethics and in legal spheres in current Western societies, but I'll touch upon it as we go along. Much of the material that I'm going to discuss and a little further developed and broader can be found in the books that you see on the screen. The 3 volumes of the Encyclopedia of Jewish Medical Ethics, which was a translation by Dr. Fred Rosner of the first edition of the Encyclopedia Hilchatit Refuit in Hebrew. The second edition expanded more on many of the topics, and even more expanded is the new set of Harifuah Halacha that deals only with the halachic issues, as opposed to the Encyclopedia Hilchatit Refuit, which deals with other aspects as well, such as the ethics, the law, the history, and many medical details. So whoever is interested and wants to see more and more references is invited to follow it in these books. So what's happening? Let's just give the scope of the issue. Transplantable organs or tissues can come from several sources. I'll expand on it in a moment, but just to list what we can do nowadays, and there are even more options. If we are talking about blood, bone marrow, semen, ovum, and ovary, it's only or predominantly live donors. If we are talking about heart, intestines, liver, lungs, pancreas, it's primarily brain dead person, although lately this has been challenged with another option, which I'll discuss a little further. Some tissues and organs can be derived from either a brain or a cardiac cadaver, such as bone, cornea, face, kidney, limbs, and skin. And again, it can come even from a live donor or from a dead donor, and that primarily is a kidney, liver, lung, and womb. So almost every tissue and every organ of the body is transplantable not only in potential, but in reality, but it depends on the donor from where we can derive these organs and tissues. So one dead person, by any type of definition, or even a live person, can donate any of these tissues and organs, and by this save or improve the quality of life of many people. If we are talking about the recipient of the organ donation, it used to be experimental. Obviously, before it became an established procedure with all the parts of it, both the surgical part and the anti-rejection medications and the better post-op treatment, when it was experimental, there were poskim such as Moshe Feinstein, the Minchat Yitzchak, Rav Weiss, and others who said that that would constitute retzicha, murder of the recipient, because without this experimental major operation, he would survive longer, and otherwise he would die earlier. That was particularly the case with the first cardiac transplants, which I'll come to a little later, where the recipients lived for weeks or less, and otherwise they could have lived more. Therefore, at that stage, it was considered forbidden. Nowadays, almost none of the organs that can be transplantable are not experimental anymore, and they can be therapeutic, except for some exceptions that I'll discuss a little later. And therefore, all the poskim agree that if the patient is an appropriate patient for an organ transplant, it is permissible. And actually, what we have to balance is the risks of both of the donor, if he's a live donor, and the recipient, whether he gets it from a live or a dead person. And currently, as I said, in almost all instances, that is permissible. So just to mention a few options as far as a donor is concerned, the recipient is always a patient who has an end-stage failure of a particular organ, whether the organ is a life-saving organ without which the person will die, or it improves significantly the quality of his life, but the donor can be from different sources. So one of the sources can be artificial organs or tissues. Interestingly, that with all our advances in technology and in science, we can't yet build an organ that can be artificially done and be effective and last long. So that's really a pele of HaKadosh Baruch Hu to give us all these tissues the moment we are alive and continue with it throughout our life for many years, and we are unable to do it. The one that has the most chances to become maybe an artificial organ is the heart, but even to this day, it is only a temporary solution, and it's impossible yet to build an artificial heart that will last for years as a normal heart lasts. So if it will be available, then obviously there will be no halachic shaylas, and this lecture will be invalid. We won't need any lectures on organ transplants because you just buy the organ and you save the person. That is, at the moment, impossible. Another source can be an animal, and again, currently, it is unsuccessful as far as major organs are concerned. I'm not talking about parts. It started already in 1964 when Hardy implanted a chimpanzee's heart, assuming that the ape is developmentally closer to the human being, but it failed. There were other animals that were studied both for kidney and heart, but it didn't work. There was another attempt to use a baboon heart, but this failed as well. And just recently, last year and the year before, there were 2 pig heart transplants, and both failed, although we are talking now with a potential to make the pig modified genetically to be as close as possible to a human being. And perhaps this might be a way to use animals, and therefore, obviously, it will avoid all the debates and the shortage of human organs. From an ethical point of view, using animals, some look at it as cruelty to animals, and some people think that animals are equal morally to the human being, and therefore they cannot be used in order to save human beings. I think this goes too far. Certainly halachically, although we know the issue of tsar ba'alei chayim, we're not allowed to cause grief and certainly kill in vain animals, but when it is helpful and certainly life-saving to a human being, there's no prohibition of tsar ba'alei chayim halachically. The major issues related to animal source of organs is the rejection, because biologically they are very far from the human being, and therefore now there are trials to modify genetically the pig or maybe other animals so that they will not be rejected more than a human source of an organ. And there's another issue of zoonosis, that it might cause a plague, a disaster, if viruses from animals that live well with them will infect the human recipient, and that might be very problematic. That is taken into account, and as I said, maybe it will work. From a halachic point of view, there's no issue at all using pigs to life-saving situation. Pig is an isur achila. You're not allowed to eat the pig, but no one thinks that you're not allowed to derive benefit, but even more so to save life, even if in order to save the life of the person you would have needed to eat the pig, it would be certainly permissible, and therefore that's not a halachic issue. And as I said, cruelty to animals as well is not an issue from a halachic point of view. Tsar ba'alei chayim is not effective when this helps a human being. And there is always the question of endangering the recipient, so we have to know that indeed every attempt was done not to risk the recipient. In these 2 cases of the pig transplant, indeed the patients died, so that probably would be halachically a major issue. Another option in the future, hopefully in the near future, is using stem cells. I don't want to go into it. We don't have enough time to discuss it. But basically speaking, stem cells can be directed into developing into an organ that we want, if we'll know the code how to do it. And then we can create from stem cells, even from autologous stem cell, where rejection will not be an issue, we can develop a heart or a kidney or a lung and use it for transplant. But at the moment, it is not available, and halachically, it is certainly acceptable, even if we have to destroy a fertilized egg in order to obtain the stem cells from this fertilized egg. Halachically, as opposed to other religions, a fertilized egg that was not implanted into a human womb is not regarded a form of abortion. That is permissible if it's done for life-saving issues, and that's certainly the case. But again, that might be the future, but not the present. Now, there are options to use organs from live donors. And the sources of live donors can be one of the list here, either a genetic next of kin, such a parent, offspring, or sibling. non-genetic next of kin, such as a spouse, emotionally related person, such as a good friend, and totally non-related, neither emotionally nor family, done completely altruistic or done for compensation, and I'll speak about that in a minute. What is certainly unacceptable is totally non-related in a form of trade or traffic. That is a form of coercion, of doing wrong to the donor, and that is not permissible neither ethically, nor legally, and nor halachically. A debatable issue is, can we take an organ from an incompetent donor, such as a minor or mentally defective? Obviously, there is no informed consent of meaning, and therefore the question is, saving the life of someone else by taking an organ from someone who can't consent to it, is it permissible or not? It's debatable. Most hold that it is not allowed because it's a major thing that a donor should do, and he should do it when he understands what's happening. So the ethical issues are the risk for the donor, the one that donates a liver, a lung, or a kidney when he is alive. There's some form of risk to him. Should he be allowed, or even can he do such a risk to himself, even in order to save someone else? And this question of compensation, should such a person, should a live donor person be compensated for the good deed that he does? So again, we'll discuss it in a few minutes. So what can be done by a live donor? The simplest indication, which I assume every one of us has done it sometimes in his lifetime, is blood donation. There's certainly no risk, and therefore the chiyuv of lo ta'amod al dam re'echa, you shall not stand aside while your fellow's blood is shed, applies to a blood donation to someone who without this blood transfusion will die. Same holds true for bone marrow, although it's a little more painful, but it's replaceable, it comes back, there's no real risk to do it, and therefore seems to be a chiyuv to do it and not only an option. As far as kidney donation, since a healthy person has 2 kidneys and he can function very well with 1 kidney, so he can be a live donor of a kidney to someone who has no kidneys. There is a small risk involved in it, and therefore the level of requirement to do such a thing, to be a live kidney donor, is debatable, and most hold that this is a righteousness to do so, but not an obligation. Because the facts are that the donor's mortality nowadays are very minimal, the immediate complications are small, recovery is quite quickly, there are almost no late complications, and as a matter of fact, almost no regrets. Even those who donated a kidney while alive and the kidney was rejected, and it seems like they lost the kidney for no good reason, most of them don't regret what they did because they gave the chance and they did a good deed. The question of compensation, at the moment, all Western societies legally and ethically forbid to compensate a live donor. It should be totally done altruistically. I have thoughts about it, and I'm not sure that this is indeed the right thing. There's almost no good deed that anyone is doing that he is not compensated for. We are physicians, we save lives, we don't do it for free, we are compensated for what we are doing. A soldier now in the war in Israel does very risky actions, but in order to save the country, yet he's getting compensated for, and actually there's nothing that you can think of that is a good deed and has to be done altruistically. So why is an organ donor an exception? I'll leave that for maybe a later debate. What are the sides, pro and con, from an ethical point of view? But halachically, it is permissible to compensate a live donor, as it is permissible to compensate a rabbi or a Rosh Yeshiva or a Dayan, which theoretically they should have been doing it totally altruistically. They should have transferred the Torah to the next generations, or judge without being compensated, and yet the halacha allows it. So the halacha would allow also to compensate a live donor with some restrictions. Now, the major issues on a dead donor, and I'm not going yet into the question, how is he dead? Is he dead by brain death criteria or by cardiac criteria or by any other criteria? But assuming that he is dead, the issues are that we have to desecrate his body. We have to open his chest, open his heart, his abdomen, or whatever part that we want to take out an organ. That is regarded as a desecration, and it is biblically prohibited. That's the basis for not allowing autopsies. Another prohibition, biblical prohibition, is deriving benefit from the dead. And obviously, if we take his organs and we give it to someone that is in need of it and we save his life, this person benefited from the dead parts of the dead person. And burial, which is also a biblical positive commandment, we have to bury all and every parts of the dead body. And here we are taking out parts of the body which will not be buried, at least not buried with the owner of these organs. And all these are a biblical prohibition. Yet no one argues that if it is a life-saving procedure, pikuach nefesh overrides these prohibitions or commandments, and therefore that is not an issue. And therefore it can be taken, organs can be taken from the dead. At the moment I'm talking about life-saving organs such as the heart, the liver, kidney, and so on. As far as organs that are not life-saving, such as a cornea or bone or other parts that are not immediate life-saving parts, they are debatable, but we will skip this for the moment. We'll talk only on life-saving organs. So from that point of view, there's no question at all that is permissible. The real question is, how do you define the moment of death? Because everyone agrees, both halachically and ethically, that one is not allowed to take an organ from a live person. So the only issue regarding organ transplants, which created a heated debate during the past years when this became available, what happened?
I reclaimed the host. Let me make you host again to share the screen. My apologies. Sorry for the intrusion.
Okay, so the only question that is debatable is, what is the moment of death? Because it's clear that we can obtain organs only from a dead person. Taking organs from someone who is still alive is killing that person. And although we said that pikuach nefesh overrides many isurim, almost all of them, it doesn't override murder. And therefore, the person has to be dead in order to become a donor. So there are various opinions of how do you define a moment of death. The most stringent opinion is that as long as the heart is functioning, even if the brain and respiration has ceased irreversibly, the person is still alive. So for that reason and many other reasons, there is a relatively new development of obtaining organs from a non-heart beating donor, meaning that the person is not only brain dead, but his heart stopped as well, and yet we are taking out some of his organs. How could it be if the heart stops that the organs are still fit to be replacing the organs that are non-fit in the recipient? So there are two ways on doing it. One is I'll call it the American way, where they take a person who has signed a DNR order, and by American ethical and legal standards, a DNR order means not only do not resuscitate, but even if you are resuscitated and you are on a ventilator, it is permissible to withdraw the respirator from such a person. And therefore, what they do is they take such a person, they take him off the respirator, they wait for a few minutes for the heart to stop functioning, they wait a few more minutes that the heart does not restart, and then they take out the organs and even the heart itself. That halachically is totally unacceptable, because halachically withdrawing a respirator is actually killing the patient. And in order to prove that the person is dead by killing him is not a way that halacha would sanction, and therefore this method of non-heart beating is halachically forbidden. There is another way, some call it the Spanish way, where a person who coded and he is not on a respirator and attempted resuscitation failed and the heart is not resuming its function, they pump a little bit the heart from outside and they take out the organs when really it is a non-heart beating on its own, not by an act that caused it not to be beating, and that is halachically acceptable. And in fact, in Israel, we started to use some of these patients in this way. So that is one option. How do I move it now? Now, the major debate nowadays is the question whether we can define the moment of death in a way that will allow us to obtain organs in a best way for these organs to function. So there are many definitions of the moment of death. Some are rejected by halacha by everyone, and some are debatable. And I'll go over briefly, and then I'll go to the definition that is of interest. So one way is to define death as a biological death. That is actually the true moment of death, by which there is a total cellular death with signs of decay, where each and every cell in the body is dead. This definition, as I'll show you in a minute, is unacceptable halachically. You don't need to wait so long. In fact, you're not allowed to wait for that, because that will postpone burial when the moment of death halachically is much earlier. But from a biological point of view, from a medical point of view, that's the only way to say that a person is dead. Because if some parts of the body are still alive, which organ or tissue is the one that is important to call the person dead? That is a societal decision, a legal decision, a halachic decision, but not a medical decision. A medical decision is only to say, if the rule is so-and-so, does this person fit the criteria? But not that this is the medical definition of death. So the medical definition should be biological death, and that, as I said, is unacceptable. And nowadays, it is not needed in any place in the world. The classic definition of the moment of death was and is cardiopulmonary death, which means that there is a total and irreversible cessation of cardiac and respiratory functions, neither respiration and brain function nor cardiac function exists, and it's irreversible, and then the person is dead. That's how people died throughout the generations, and that is how some think that only this is the moment of death. The other option is a whole brain death, which relates to the brain per se, and therefore only when total and irreversible cessation of all brain functions, including the brainstem, has occurred, even though the heart is still functioning. And that can happen only if the person is on a respirator, because a person not on a respirator, when all brain functions die, the heart will stop within minutes. So that will be no difference from the cardiopulmonary death. But if the person is on a respirator, the situation can be that all the functions of the brain ceased irreversibly, and yet the heart is still functioning. A subtype of this definition is respiratory death, which means total and irreversible cessation of respiration, and that I'll talk about in a minute. And there are some ideas that at the moment no legal system has adopted, and I hope it will not be adopted, and that's cerebral death, which means a total and irreversible cessation of cerebral function, where the brainstem is still functioning, and we call the person dead just because he can't sit now here and listen to the lecture, for instance. That is not sufficient to call a person dead, but some want to advance it to say that if a person has no cerebrum and he can't understand anything and can't feel anything, he should be regarded as dead, even though he's breathing and his heart is functioning. That halachically is totally unacceptable. So any definition on the moment of death requires the total and irreversible cessation of the appropriate function or organ. If you say brain death, then the brain has to be proven as irreversibly dead totally. If it's a cardiac one, the same thing. Any definition defines a biologically arbitrary moment within an ongoing process of dying while various body parts remain alive. I think that's a very important thing to understand. Even in cardiac death, there are organs and tissues that are still alive, and yet we call the person dead. His kidneys are still functioning even half an hour or more after cardiac death, and halachically, everyone agrees that we call him dead. So the fact that there are still organs or tissues that are alive does not negate the halachic or social definition that the person is dead, because a certain function that is regarded as the boundary between life and death ceased irreversibly functioning. So the biological death, as we said, is the only scientific medical definition. It was acceptable in the 18th century because of medical errors in establishing death, but currently it's unacceptable anywhere, and especially halachically, it is rejected. The cardiopulmonary death, again, from a pure medical point of view, is arbitrary, because at the time that the heart and lung are not functioning, the kidneys are functioning, the skin is alive, and so on. So that is not a point from a medical standpoint to say that the person, the total person, is dead. That is the most established definition throughout the ages, and currently, still, most people die with this definition, namely, most people die not being on a respirator, and if you're not on a respirator, then the cardiopulmonary death is the one that defines death, and most people die in this way even today. And conceptually, these are functions that are associated with life, which are breathing and circulation, and also the body appears dead in a sense that it is cold and there are no vital signs on monitors. The whole brain death concept, again, is arbitrary from a medical point of view. It's relatively new. It initially was defined in order to satisfy needs, not that philosophically someone woke up one morning and said, let's call this dead. And the reason for that was that ICUs developed and organ transplantation developed, and for that you need an earlier moment of death than the cardiopulmonary death. But conceptually, it seems that this is a right decision, ethically speaking, because the brain is integrating the organism, and it is the seat of mental and vegetative functions, and therefore, if it dies, the person actually dies. All legal systems throughout the world accept this definition, but there is still a strong, heated debate among halachic authorities and some minorities of other people that reject this definition. Okay, respiratory death, I'll speak in a minute, and cerebral death, I said before. Now, a question always asked is, why do we need an exact moment of death? Why shouldn't we wait? Well, the person stops breathing, his heart is weakening, his heart stops. Let's wait and see what happens to him. Why do we need to know exactly what the moment of death is? So that has a lot of ramification. From a legal halachic point of view, for instance, when do we bury the body? And we're not allowed to postpone burial. Even more important is treating the patient on Shabbat. If he is defined dead by either definition, then we're not allowed not only to treat him, but even to move him, because a dead person is muktzeh. You're not allowed to move him. So the exact moment of death will determine how do we deal with this person on Shabbat. When mourning starts, when inheritance comes, if someone injures or kills someone who is defined already as dead, so the moment of death exempt him from a capital punishment. And from a medical point of view, it is important for ICUs not to keep a person who is dead in an ICU where he occupies a bed that might be needed for someone who has a chance to survive, and for organ transplantation, because as we said, the permission to get organs from a person is only at the moment of death. Historically, interestingly, how did people in the old days say that a person is dead? What they used to do is put a feather next to the nostril. If the feather was moving, it's a sign that he is still breathing and therefore he is alive. And if the feather is not moving, it was assumed that he is not breathing anymore, and that was the moment of death. Obviously, that is very difficult to accept nowadays, because there are so many cases where either the feather is moving or not moving, and it's really not a good determinant of death. In the later years, especially in the 18th century, the diagnosis was done by cardiorespiratory death, and the way to diagnose it was by putting a feather to the nose and putting the ear on the chest to hear or feel a heartbeat. Now imagine an elderly physician who puts the feather on the nose, and there was some movement, but he didn't see so well. So he checks, no breathing. And he also doesn't hear anymore so well. He puts his chest, he put his ear on the chest, and there was a weak beat, but he didn't hear it. And he checks, no heartbeat. And people go and bury this person. And there were apparently enough situations where a person awoke in the grave and screamed or whatever and was taken out because he was misdiagnosed as dead, and to the degree that they created special coffins to bury a person. Here you see the person underground. This is ground level, and he's buried in a coffin. His hands hold a string. The string is attached to a bell with an opening for air, and if he wakes up in the grave, he moves the string and he rings the bell, and so he's being saved. And that's the expression in English, saved by the bell, because in those days, ringing the bell was a method of saving apparently enough people that a patent was listed to this type of burial. That created a significant debate between Moses Mendelssohn and Rabbi Yaakov Emden, the Yavetz, where Moses Mendelssohn approved the ruling of the time that said, even if a physician diagnosed death by those signs, we are not burying him until 3 days go on and he's not waking up. Whereas the Yavetz said that this is forbidden halachically because it's delaying burial, it's baltalin, and if the physician diagnosed death with the signs that are acceptable, we shouldn't wait 3 days. That debate went on, and apparently, a generation later, there is a tshuva by the Chassam Sofer, one of his last tshuvas in his lifetime, and he brings this debate between Moshe Mendelssohn and the Yavetz, and he himself came to the conclusion that we will discuss in a minute, that the Yavetz was right and the person should have been buried right away and not wait for 3 days. Nowadays, nowhere in the world are such laws that you postpone burial for 3 days if a physician diagnosed death. So the movement was from cardiopulmonary death to respiratory death, which was called brain death. And the debate was created because of what happened with the first and the second heart transplants performed by Christian Barnard in Cape Town, in South Africa. So the first, and it's important to understand it, the first heart transplant was December 3rd, 1967, in the Groote Schuur Hospital in Cape Town, where Christian Barnard took a heart from a car accident victim by the name of Dennis Darval to a patient which happened to be a Jew, Louis Vashkansky, who passed away after 2 or 3 weeks. The second transplant, again done by Christian Barnard a month later, in January 2nd, 1968, and again it was a person who collapsed to a Jewish person, and again the recipient died. And he decided, Christian Barnard decided, that the donors, the woman in the first case and the man in the second case, were brain dead, although at the time there were no criteria to establish brain death, because the first criteria were published at the end of 1968, which are called the Harvard criteria, which to this day, with some modifications, most countries use it as the criteria to establish brain death. And that happened only a year after the 2 first heart transplants. And therefore, the question was, what was the situation of the donors in the 2 cases? So this is Christian Barnard. And currently, the hospital that these 2 operations took place is not functioning anymore as a hospital. And they turned it into a museum, a wax museum, that shows the various stages that Christian Barnard did during these 2 operations. So first they show a dog that he experimented on to do the procedure, and he was very good at the procedure. But at that time, there were no anti-rejection medications, and therefore the patients died. They didn't die because of the technology, which was good. They died because of rejection, which they didn't know how to treat. So he did these experiments. And here is a real woman, which I'll explain in a minute, and a VAX stage where supposedly the victim is lying and they are taking out his heart. And this is the recipient, Vashkansky, who post-op for the few days that he lived, functioned very well. The heart functioned okay. He read a book, he talked, he even went down to walk, but he succumbed to rejection. Now, this woman was, she participated in the operation. There are very few people still alive that participated physically in this operation. And she was my tour guide to explain what happened there from what she saw with her own eyes. Now, why was it important? Because once the procedure was published, apparently it was related to Rabbi Feinstein as a situation where Christian Bernard decided that the brain was dead in these two people, although they were still breathing. That was the understanding at the time. And he says it very clearly in his first tshuva on the issue of brain death. מה שאומרים הרופאים שסימני חיות ומיתה הוא במוח, שאם לפי השערותיהם אין המוח פועל פעולתו, הוא כבר נחשב למת, אף שעדיין הוא נושם, האמת ודאי שלא זה שפסק המוח לפעול ומיתה, לכל זמן שהוא נושם הוא חי. In other words, the reason that Moshe Paskin, that it was a double murder at the time in 1970, was because he assumed, or he was told, that the patient that was the donor was still breathing. And the assumption of the physicians was that if the brain is dead, that's enough to call the person dead. Now, I asked this lady what actually happened there. And what she told me was that Christian Bernard, with the neurosurgeons at the time, decided that the head injury was so severe that the person can't be alive. He took the first lady to the OR. He disconnected her from the respirator. He waited for the heart to stop, very similar to what's happening today with the non-heart beating situation, and took out the heart and transplanted it to the recipient. That certainly was not a case that the person was still breathing. It's impossible. So this information, the information was wrong. However, the way that he did it, in my view, was even worse than taking out the heart while the patient was breathing, because here he withdrew the respirator and actually killed the patient and took out the heart. But the important message that this case brought, even according to the misunderstanding of the situation, is that according to Rabbi Feinstein, breathing is the criteria whether a person is alive or dead, and not heartbeat. And the reason that he called it a double murder was because he assumed that the person was still breathing. So I don't want to go into too many details of the anatomy and the pathology of brain death. I assume everyone here knows it, that the center for breathing and for respiration is in the brainstem. And if we can prove that there's no brain function, then we can prove that there is no breathing. And that is the main criteria according to Rabbi Feinstein, the Chief Rabbinate, Avadi Yosef, and others that I'll say in a minute. Now, in order to verify that indeed we are talking about brain death and no breathing at all, there are two stages that the world is accepting, and there is a third stage that in Israel we insist on, which was the position of the Chief Rabbinate and subsequently became the law of the land. So one criterion is a prerequisite that we know the etiology, why we assume that the person is brain dead, because if we don't know, maybe it's still reversible. There are no reversible underlying conditions that can be taken care of, like hypothermia or CNS depressants and so on. And then we do the clinical testing, which is in 3 stages. Stage 1 is to assure that the person is in a deep coma, which is called Glasgow Coma Scale 3, which means that he doesn't respond to anything. You can cause him pain, you can yell at him, he doesn't respond at all, so it's in a deep coma. There are absent brainstem reflexes, which include the pupils, corneal reflex, gag reflex, and a cold caloric test. And after this is attested for, there is an apnea test where we do a certain maneuver to prove that the patient is not breathing on his own at all and can't breathe. So if we combine the fact that the brain and the brainstem are totally dead, and we prove that the patient is not breathing, that is sufficient as a clinical criteria, according to Harvard criteria, to say that the person is dead. In Israel, based on the chief rabbinate's position and subsequently the law, there has to be a confirmatory test which either shows absence of blood flow to the brain by various techniques, or absent brainstem electric activity, again, by various technologies. And only if all fit, then we can call the person brain dead. So as far as etiology, these are examples. If you see such a major bleed or such a major trauma to the head, you can assume that the person is brain dead, and then you can do the testings and make sure that he is indeed brain dead. The clinical criteria, I assume everyone knows. I just want to mention the oculovestibular reflex or the cold caloric test, where we inject ice cold water into both ears, one at a time. And a person that has any function of the brainstem can't withstand such a stimulus without moving his eyes. If it's cold towards the ear that we inject the cold water, if it's warm away from the ear. But if you see no movement of the eyeball, that is one of the most potent testings to say that the brainstem is not functioning. After we do this, we do an apnea test, which is we disconnect the person from the respirator after supplying him with oxygen for about 10 minutes to have all his organs filled with oxygen. And then when we detach the respirator, it is not causing him to die because of this act, because he's filled with oxygen. And we are looking for respiratory movements in extreme situations where we take the person to the maximum PCO2 level that no human being alive can withstand not breathing. And if nevertheless he's not breathing, that is a sign that his brainstem and the respiratory center have gone. The confirmatory test, the standard test is a carotid angiogram. We don't do it usually. It's a very invasive test, but there are others such as transcranial Doppler or radionuclide angiogram and many others. I don't want to go into the details, but once we can prove, we can confirm that the clinical signs are really showing that the person is brain dead, then we can rely on the diagnosis and call him respiratory brain dead. But again, the major point of death is respiration. It's not the brain per se, it is the fact that he is not breathing. The brain, or if we take the heart, are only there in order to verify that it's irreversible, but not being the cause to call the person dead. So let's now go over the halachic considerations. So all who discuss this matter bring the sugya in Yuma, which I'll bring in a minute, and based on the sugya in Yuma, the poskim, Rambam and Shulchan Aruch, and there are some supportive tshuvas, one by the Chacham Tzvi and one by the Chatam Sofer, that we can derive from it how to define the moment of death. So the Gemara in Yuma, which is the basis for all poskim to relate to, discusses a situation where a building collapsed on Shabbos and there are people under the building. And we know that there's a person there, but we don't know if he is alive or dead. So it's a safek pikuach nefesh, and therefore we are allowed to move away all the debris, get to him, and if he is alive, save him. But once we get to him, we need to know if he is alive or dead, because if he is alive, we're allowed to desecrate Shabbos further. If he's dead, we're not allowed to do anything more, because for that person, we're not allowed to desecrate Shabbos. So therefore, the Gemara talks about how do you diagnose the death of the person. So one says ad chotmo and one says ad libo. So there are two opinions according to the Girsa of Rashi, and it's important to state it, and we'll see in a minute, that according to one opinion, you get to the body after removing the debris up to his nostril. And then you check in the nostril whether he's breathing or not. You put a feather and you see if he's breathing. And if he's not breathing, he is dead, and you're not allowed to desecrate Shabbos further. And others say that you get to his heart, and we understand today that the heart has a function to push blood. So we want to see if the heart is beating, pushing blood. And if the heart is not beating, according to this opinion, then he is called dead. And the Gemara discusses further sources, and the conclusion of the Gemara is that for Pikuach Nefesh, everyone agrees that only the nostril, which is the sign for breathing, is what counts to finally decide whether he's alive or dead. And the Gemara brings even a pasuk that says, Kol asher nishmat ruach hayim be'apav. That is a pasuk from the Mabul. Who was dead in the Mabul and who was not dead? Anyone who is still breathing was still alive, meaning that whoever is not breathing is dead. So breathing is the sign of life and death, according to the Gemara. That is accepted by the Rambam, בדקו עד חותמו ולא מצאו בו נשמה, מניחים אותו שם שכבר מת. It's sufficient to test the nostril, and you don't have to go further and test the heart. And I draw your attention that the Rambam says, לא מצאו בו נשמה, which means soul, whereas we are talking about neshima, which means breathing. And indeed, etymologically, neshama and neshima is the same source. So therefore, if there is no neshima, there is no neshama. And that's where you test it. And the same, the Shulchan Aruch and others. Now, what is the function of the heart according to Rashi's Gersa? I don't want to go now into others who don't mention the heart at all. They mention the diaphragm, and the question is, what does the diaphragm have to do with the definition of this? But importantly to realize that the Chacham Tzvi was asked a famous question where a woman opened a chicken and she didn't find the heart. And she came to the Beis Din in Amsterdam to ask if the chicken is kosher or not. So the Beis Din said it's treif because nitala lev, taref. Came the Chacham Tzvi and said, it's impossible that it happened this way because no adult chicken that was shech can survive without a heart. If the chicken didn't have a heart, she wouldn't live. And why is the heart so important? Says the Chacham Tzvi, what is here in red, אבל הנשימה היוצאה מן הלב דרך הריאה היא ניכרת כל עוד שהלב חי. In other words, in those days, up to the Chacham Tzvi and even further, before Harvey discovered the circulation, the assumption was that the heart is an organ of respiration, that actually what the heart is doing according to the ancients was what we know today that the lungs are doing. So that the heart, according to them, was pushing air, not blood. And it was part of the respiration. And everyone accepted the Gemara in Yuma and the conclusion of the Rambam and Shulchan Aruch that everything is dependent on breathing. And therefore, if the heart doesn't exist, the person couldn't be alive because he couldn't breathe. So the heart has nothing to do, in the Gemara, has nothing to do with our heart, with our understanding what the heart is. So in other words, all opinions relate to breathing. And the question is, where is it best to test if the patient is still breathing? Is it best to test through the nostril or through the heart, which is a respiratory organ? And therefore, if the decision is that it's better to test through the nostril, then respiration was discussed in the nostril. And the Chacham Tzvi brings a lot of sources of the Rishonim that the heart is the organ of breathing, and therefore without a heart a person can't live because life and death is dependent on breathing. That was the understanding, and therefore there are gerses that don't mention the heart in the Gemara in Yuma, but they mention the diaphragm, which again is a way of breathing, a diaphragmatic breathing, and therefore the movement shows whether the person is breathing or not, but all relate to breathing. If now we know that the heart has nothing to do with breathing, and the breathing is the sign of life and death, therefore the heart is irrelevant in defining the moment of death. That's the understanding of some of the poskim. Now the Khatam Sofer brings the story that was a generation before him between Moses Mendelssohn and the Yavetz, and he decided like the Yavetz, and he says that he wants to understand what is the moment of death halachically. And what he says is, הכל תלוי בנשימת האף כמבואר ביומא פ"א ופסקו רמב"ם וטור שולחן ערוך. His conclusion is that everything is dependent on the nose, meaning not that the nose exists or not, but there is breathing through the nose, and that is the understanding from the Gemara and the Rambam, as we said. The Chassam Sofer brings another issue from the Rambam in Moire Nevuchim, which is very strange to bring Halacha, the Rambam of Moire Nevuchim. I won't go into it. If there will be questions that someone wants to relate to it, I'll be happy to answer, but that is what the Chassam Sofer said. Now, in our generation, once brain death was regarded as the death of the person, the debate came back whether the heart is the sign of death or whether the brain. So the machloikes is quite heated. Unfortunately, it became political, even personal, which I don't think that in halacha it should lead there. We should hear each other and try to answer to each other, accept or not accept, but it is wrong to bring it to political and personal issues, so I don't want to go into it at all. And the idea is that biological death, as I defined it earlier, is totally unacceptable halachically because it is unlawful to delay burial. Some Rabbonim hold that cardiopulmonary death is the only death, so that even if the person is brain dead and not breathing on his own, but his heart is still functioning, he is still alive. Among the poskim who hold this way were Rav Elyashiv, Rav Wosner, and Rav Waldenberg. Rav Auerbach had a very unique Das Yochid definition of the moment of death, and others hold respiratory death confirmed by brain death or by cardiac death. And that were Feinstein, the chief rabbinate of Israel, Rav Zalman Nehemiah Goldberg, Rav Ovadia Yosef, Rav Moshe Sternbuch, and others. Cerebral death, as we said, is totally unacceptable. So these are some of the poskim who hold that you need the heart and breathing is not sufficient. Rav Eliashiv held firmly this position, but I asked, what is the basis of Rav Eliashiv to paskin that way? I asked from Rav Efrati, who was very close to Rav Eliashiv. He wrote me a few words, as you can see here, but actually there's no halachic clear definition that it's dependent on the heart. It's just a general approach. Rav Zilberstein as well wrote a tshuva to explain, but again, it's not so very clear. What is clear is that Rav Eliashiv did not accept brain death. This I heard from him personally, and he held that the heart is the function to define death, but it's unclear his position, why he held this way. Rav Shlomo Zalman Auerbach had a very unique position. Again, if time will permit, I'll be happy to explain it. We did even an experiment of the pregnant sheep that he designed, and actually he was satisfied with the experiment, but then he was a little bit hesitant. That's the little calf that came out of the pregnant sheep that was decapitated, which means that she was totally dead by all criteria, Huta Zarosh Metame Be'ol, yet she was able to deliver. It was a C-section, but the calf came out alive, which was an answer to a certain question that Rav Shlomo Zalman had from her Gemara in Erchin. Again, this is a complicated matter. We even published it in a journal that the experiment with the pregnant sheep proves that the heart can continue to function for a long time, even if the head is totally decapitated from the body, which certainly means that the heart can't be a sign of death in these circumstances. Feinstein is a debatable question what his position was. And to me, I think it is clear what his position was. So, as I already mentioned, his first tshuva on brain death was after the first 2 heart transplants. And it is clear that the fact that he regarded it as retzicha was because he understood that the donor was still breathing. Subsequently, he adopted the position which he already hinted to by the first tshuva, that the Gemara Yuma shows that all depends on breathing, and in the final tshuva, from 1976, he adopted the Harvard criteria to say that if the Harvard criteria are fulfilled, which means that there is no breathing, and that is irreversible because the brain is irreversibly damaged, even if the heart is still functioning, the person is regarded dead. That is a clear statement that he gave at that time. And this is the official tshuva of that date, which he signed, and the debate, I think, closed by that. But some published the opinion that actually this tshuva was falsified because Moshe didn't know how to type on a typewriter, and someone typed it for him, so maybe they typed it whatever they wanted, and he signed without reading, which is unheard of to say such a thing of such a Goen. But even further to verify it, Reb David Feinstein, his son, wrote very clearly that this tshuva is real, not falsified, and whoever says it is wrong by saying it. It's not only the written tshuva, but he himself heard it from his father, and he repeats that even if the heart is functioning, if he is not breathing, and we know that it's irreversible, then he is dead according to his father. So I think that is a very clear position of Rav Moshe. The chief rabbinates of Israel, Rav Shapira and Rav Eliyahu, were asked officially by the Director General of the Ministry of Health in Israel at the time. It was in 1986 when the first heart transplant was contemplated to be done in Israel, because cyclosporin was already invented and the technique was known and the anti-rejection medication was available. So the Director General of the Ministry of Health referred to the chief rabbinates and said, since this question, whether the person is alive or dead, is not a medical question, but it is a religious question, therefore I turn to you to ask what Halacha says about defining the moment of death. If you'll accept the brain death and the respiratory death, then we can proceed with heart transplant taking from such donors. And the chief rabbinate of Israel wrote an extensive response accepting the concept of brain death and respiratory death, referring to Reb Moshe even before the last letter that stated it very clearly. But they had certain conditions that the medical establishment refused to accept for many years. I don't want to go into the details, that's already some details, but I'll refer to the final point. And the chief rabbinate's position was accepted by all members of the special committee that the chief rabbinate established, and by all members of the chief rabbinate's council at the time. And they all signed on this psak that brain death in principle is acceptable if it points to the fact that respiration ceased irreversibly, but they demanded assurances that the medical establishment refused to allow it. The other chief rabbis reaffirmed the first decision, all of them, including Rav Ovadia Yosef and Rav Amar. And in fact, it's a long story, I think an interesting story, but the bottom line was that we sat with Rav Ovadia Yosef, Rav Amar, myself, and some of the politicians from Shas, because it came to the Knesset for vote. And at that session, Rav Ovadia Yosef said clearly that he accepts brain death and respiratory death. Clearly, the heart has no function in defining the moment of death. And Rav Amar wrote out the conclusions, and Rav Ovadia Yosef co-signed to this letter, and that is the official position of these two chief rabbis. The current chief rabbis, Rav Yitzchak Yosef and Rav David Lau, also reaffirmed this conception, and so that there are those who agree and those who disagree, but the law, which is called Brain Respiratory Death Act in 2008, established that the moment of death legally is the brain respiratory death, and the emphasis is on respiratory because that is the halachic sign of death, and the brain is confirming that the person, that this situation is irreversible. What were the points that were added to the law, which is unique to Israel, and in any other country who wants to establish, whoever accepts brain death and wants to establish it according to the chief rabbinate of Israel, needs to do more than in those countries is being done. So in Israel, it has to be 2 expert physicians from specific medical fields. The list is attached to the law himself. they should be uninvolved in the treatment of the person or in organ transplantation. A medical public committee is responsible for the training and education of the physicians and for inspection and control of their diagnosis. And in Israel, only physicians from the list who were trained and were tested and got a license can participate in the committee that diagnoses brain death. So it's not a young physician who has no experience. It has to be someone who really was tested, that he knows all the rules and regulations, and it is followed to make sure that there were no mistakes. The prerequisites and the clinical criteria are the same as in the Harvard criteria, but by law in Israel, every case has to have a confirmatory test, which is listed in the law what is acceptable and what is not, and only then can a person be diagnosed as dead. Now, Rav Elyashiv did not accept this proposition of the law because, according to him, as long as the heart is functioning, the person is still alive, and the law allows for a person to be dead, including to take out his organs, even if the heart is functioning, as long as all these criteria were met. So for him to accept the law in some way, there's an added paragraph in the law that says that whoever is diagnosed brain death, but halachically, philosophically, or whatever reason he or his next of kin do not accept this definition, he will stay on a respirator until his heart will stop. So that can be helpful to those who follow Rav Elyashiv and other Rabbonim who are of his opinion, and therefore in Israel there are two sets of people, either those who accept brain death and respiratory death, whether they are non-religious, secular, and they think that ethically it's okay, or they are religious, but they follow those poskim who accept brain death, and those who in principle don't accept brain death will remain on a respirator until the heart will stop. Obviously, they are lost to organ transplants, but if they feel that they are still alive while the heart is functioning, it is impossible to take out the organs because, according to their view, it is murder of what they are. So this is how a license looks for someone to be allowed to be part of the team to diagnose brain death. Everyone has a number of license, and only he can diagnose brain death. And that is the situation today in Israel. Thank you.
Thank you so much, Rabbi Steinberg. Before we go to the moderated question and answer that's going to be led by Dr. Rubin, if anyone has any questions, please send your questions through Dr. Rubin so there's no duplication, and for the sake of clarity for the rest of the audience. I would like to reiterate my thanks to our organizational partners in this JPN and Ematai Grand Round session. That is, of course, Ematai. Rabbi Shlomo Brody, do you have a moment?
I just want to say thank you, Rabbi Steinberg, as always, for learning from you. And I wanted to tell everyone that there was a book that came out a few years ago by Rabbi Steinberg on this topic, a wonderful kuntres, which Mirz Hashem we're going to be republishing soon. It just needs to be updated a little bit by Professor Steinberg. Professor Steinberg is very busy completing the Encyclopedia Talmudit, massive monumental project. But this is my monthly reminder to Professor Steinberg that we're looking forward to the updated version of this as well. But thank you as always.
Thank you.
All right. Without any further ado, Dr. Jonah Rubin.
All right, it's Jonah Rubin on this group. Thank you. Thank you, Steinberg, so much. I'd like to. We have a whole series of questions. I'd like to be selfish and start with one of my own, but it's also something that Dr. Pop and I have discussed. It's been discussed in the broader Jewish Physicians Network group. And we were curious how you would approach determining death in a patient who is on ECMO, cardiac ECMO, so they have absolutely no cardiac function at all. I know some postgame have said, okay, sometimes when the patients are awake and talking, clearly that person's not dead. But let's say they have some sort of brain injury, but they're not brain dead, but they're not conscious, they have no cardiac function, and they're only alive because they're on VA ECMO. Like, how can you declare death on such a patient and discontinue ECMO?
Well, I discussed it with some of the Rabbonim. Nowadays, the Rabbonim that I discussed, brain death, like Shlomo Zalman Auerbach, Rabbi Elyashiv, didn't know about ECMO, and in those days, it wasn't available. Now that it is available, I discussed it with some of the poskim. I don't want to mention names, maybe they don't want to be identified, but the assumption is that the ECMO is like a respirator. In that sense, that withdrawing it is actually causing death. Although if the heart is not functioning at all, then physically and autonomously, the person is actually dead. It's just a machine that works, but you can argue the same with a respirator. If he's totally dependent on a respirator, if you stop it, you actually stop something that didn't function anyway. And yet, that will cause the person to be dead, and therefore their view is that we can't withdraw it. However, what I would suggest to do is what Rav Shlomo Zalman, Paskent, and Rav Wosner agreed with him regarding a respirator. Sometimes, let's say a person has a DNR order, which halachically may be acceptable. For instance, if he's a dying person, that his life expectancy is less than a year, halachically defined, but practically less than 6 months, and that's how the Israeli law defines a dying patient. And he has a DNR order. But when he arrested, the person who came in didn't know that he has a DNR order and intubated him. And now he's intubated, and it's against his wish. And if we would have known it, we wouldn't intubate him, because it's okay to withhold treatment. What is not okay is to withdraw, to do an act. But B'Sheva Al Taseh, we allowed not to supply life-prolonging measures. But now he's stuck on the respirator. What do you do? So Shlomo Zalman said that what you can do is reduce the parameters of the respirator to a minimum that the patient is still stable. Let's say he's now 100% oxygen. You reduce it to 80 and he's fine. You reduce it to 60 and he's fine. And you reduce it to 40 and he is not fine. So you go back to 60. You stay at that level. And obviously, he will need more oxygen today or tomorrow. And then you're not obligated to increase the oxygen. And he will die on the respirator without doing an act that will kill him. And I think you can do the same with the ECMO, although sometimes it's more difficult because the parameters are a little different, but you certainly don't need to exchange the tubing and all kinds of preserving the ECMO to continue to function. You stay at the level that the patient is at, you reduce whatever you can reduce, you don't replace any of the parts of it, and the patient will subsequently die without you doing an act of withdrawal. That, I think, is the best I can say, although personally, and if I'm not a POISEC and no one should take it practically, but I think that an ECMO is different than a respirator, and even withdrawing it would not be considered killing because the heart isn't there anyway. So you're not killing, you are killing the dead. So I see a difference. But as I said, those poskim that I consulted with, most of them, not some agreed with me, but most didn't. So I think that we still can go in this direction.
Thank you very much. I appreciate your final point, because what I would ask back to those who say that it's the same as a respirator is that when you withdraw a ventilator, what that leads to is a patient having a cardiac arrest and dying through cardiac criteria. And a patient who's on VA ECMO, their heart has already stopped. So by what mechanism have you killed them by removing it? Their heart has already stopped. They're in a persistent vegetative state. Thank you.
By the way, if I may add to this, I heard, I didn't see it in writing, so I'm afraid to relate to it, but I heard that Rav Wosner, who didn't accept brain death, said that in a case of an ECMO, and he held that you can't withdraw it, it can go forever or whatever for a very long time when the person really by rational assumptions he is dead, he would rely on brain death in this case. So then if the person is, by the way, whoever accepts brain death, then the solution is easy. You diagnose him as brain dead, then you can remove the ECMO like you remove the respirator. That would be easy. I'm talking about those who don't accept brain death, or if the person doesn't fulfill the criteria for brain death at this particular moment.
Thank you. I'd like to, there's many questions. I don't know how much time the Rav has, but I'd like to ask Rabbi Brody, would you like to ask the question you sent me? Sorry.
One of the questions that came in from a Laser Friedman was if Rav Steinberg can address the case of the objection of the cardiac death camp. There's ongoing hypothalamic activity in respiratory brain dead individuals. How do we deem someone dead if there's ongoing hypothalamic activity?
Right. So from my understanding, and I think that was the understanding of the chief rabbinate and certainly Reb Moshe, what counts is respiration. All the rest is irrelevant to death. Now, why do we look at the brain for respiration? Because we know that the center of respiration is in the brainstem, and we want to be sure not only that the person is not breathing, but it's irreversible. Because if I'll do the following, I didn't breathe now. Am I dead? Obviously not. Why am I not dead? Because I resume breathing. So if you have either cardiac death, which is, according to this position, not the reason for the person to be called dead. The reason is that he's not breathing. But when the heart stops, the non-breathing becomes irreversible. So the same holds true when you use brain criteria to make the respiration irreversible. In this case, the hypothalamus has nothing to do with brain function. It's actually a hormonal organ. It could have been situated in the stomach or somewhere else. HaKadosh Baruch Hu attached it to the brain, but it's not brain, and it certainly has no effect whatsoever on breathing. So if we stick with the original definition that irreversible cessation of respiration is the moment of death, the fact that the hypothalamus is still functioning is not different than the heart that is still functioning or the kidney is still functioning. And we said that for defining a moment of death, you don't need each and every cell in the body to be dead. The biological death is not a halachic criteria. So therefore, I think it's irrelevant for the definition of death according to those who accept respiratory death. Now, because the hypothalamus has some special circulation, it might be that the pressure that is created, the edema that is created in the brain that stops the blood flow to the brain, and that's how we diagnose that the brain is irreversibly damaged, does not affect the vascular system that goes to the hypothalamus, which is separate, which also points to the fact that that is not part of the brain. It is a separate organ situated in the brain. And therefore, I think it's irrelevant for the definition according to the position that accepts it.
Thank you. I also received, just on this topic of brain death and declaration of death and controversies, I received a text. I'm sorry, I'm not sure who this is from, who I think is asking, what is the motivation of those who contest Rav Moshe's tshuvas, and suggest that his real opinion differs from what seems to be clearly his written opinion?
Well, I can't speak for them, but I would assume that they will feel more comfortable. Rav Moshe was the posek of the generation. And if Rav Moshe held differently, it's a heavy burden on those who wouldn't accept brain death, right? So it's easier to bring him to their camp and to say that he also thought so, and someone just mixed it up, and we know who the someone might be, and so on. But I think that is really degrading the greatness of Moshe to say that he signed on something that he didn't understand, that he didn't read, that they fooled him. And the fact that it was written half a year before he died, there were many tshuvas written in this period of time. So why is this tshuva different than any other of the tshuvas? So you can nullify all his tshuvas from a year or 2 years prior to his death. That doesn't make any sense. It never happened with any posek, and I don't see, and especially that his son, who was the closest to him and was a tremendous Talmid Chochem on his own, that testified that this was his position. I find it very, very difficult to accept an opposing view, but maybe the motivation is that Moshe shouldn't be against their position. That's fine.
Understood. Dr. Pop had a question. Would you like to ask? Sorry, you're muted.
Thank you. I was wondering if Professor Steinberg could clarify what additional treatment in addition to mechanical ventilation is required in the situation where a patient made clear before their injury or the family is not accepting brain death as a criteria for death in the Israeli law.
Just to state it, there's no need for any kind of signed document or legal document. If the family comes and says, we belong to, and the patient, we and the patient belong to the group that accepted Rav Eliashiv's or Rav Wozner's or Rav Wallenberg's position, and therefore we don't accept brain death, then that is sufficient to let the patient be on the ventilator until the heart stops.
What additional treatment, if any, besides the ventilator needs to be provided in those cases?
That's also debatable. Everything became debatable. I heard it from Rav Eliashiv himself. I was there when I proposed to add this paragraph in order for him to let Aguda to vote, to accept it, not to vote for, but to accept it. In a different way, I don't want to go into it. But he told then that if the paragraph will say that he is left on the respirator, that is sufficient for him. That is not killing, because obviously he understood, and everyone understands, that in a situation where he is brain dead and can't breathe on his own, he is a dying patient. And in a dying patient, there is no obligation to continue or to certainly to add life-saving procedures. So there's no need to do anything else besides not doing an act that will hasten death, which is withdraw the respirator. But after he died, some people thought that they heard from him that any treatment has to continue, whatever he is already getting. So if he's on antibiotics or on dopamine or on dialysis or whatever, it should be continued, which is not what I heard from him. So I only can testify what I know.
Thank you. We have one question about whether or not there are any instances where an apnea test might be usher in halacha.
Again, I didn't hear.
Is there any situation in which the apnea test is against halacha?
Well, I don't think so, because if it's done carefully, there are two prerequisites to do it. One is that you did all the testings prior to the apnea test, meaning you did a Glasgow Coma scale, you did all the brainstem reflexes, and you have a confirmatory test. In this situation, verifying that he is not breathing on his own, which is the criteria to say that he is dead, and all the rest are just supportive to say that it's irreversible, that is what you do. Now, in the old days, you would put a feather. You can do it today too and say he's not breathing. But we don't want to rely on it. We want to be sure that he's not breathing, and therefore we do the apnea test. Now, the argument not to do it is that this will hasten death. He is now on a respirator. You remove the respirator in order to test if he's breathing on his own. That by itself will hasten death. So we are very careful in how we do the apnea test. We first fill the person with 100% oxygen for 10 minutes, so that even without the respirator, there is no reason that he should die of lack of oxygen, of hypoxia, because he is filled with oxygen. And when we increase the PCO2, that by itself is not hastening death. It's just stimulating the brainstem respiratory center to start breathing. And if we don't see that he's breathing, he's dead. And if he's dead, you can't kill him again. There's nothing that kills him more than being dead. He's dead. So I don't think that there's any worry, and we do it all over the world, and I don't mean only myself, but all over the world they're doing. Yes, there are patients who are unstable at the time, and for them we don't do it. Or we start doing it and we see that it becomes unstable, we right away stop it. But then, halachically, we can't establish the moment of death. So there are rare situations where we can't finalize the movements that are needed to make the person diagnosed as brain death, and then we have no choice but to wait for cardiac arrest. But that's very rare. For my memory, there were only 2 cases that we couldn't do it.
Thank you. And we have a question relating to something that you mentioned in the beginning of the talk, that certain donations like bone marrow or blood or donating blood are such low risk that it might even be a chiyuv to do. And on that basis, is there ever a situation where you can do this against someone's will? Maybe even with a captive or a prisoner, but even just anyone, I would imagine, is the question.
Right. So again, there is a little bit debate about it. My personal opinion is that you indeed can coerce someone to donate blood if this is a life-saving situation. To donate blood just to be in the blood pool, that obviously you wouldn't coerce. You would try to explain and to get his permission by explaining him more. But if you have a rare blood type and a person is going to die unless he gets this rare blood type, and there's a person that is before you and he has this rare blood type, and by taking his blood and transfusing it, you're saving immediate life. This to me is a situation when you can coerce. Life in halacha takes precedence over autonomy. It would be unheard of in the United States to do such a thing. If he's an adult who refuses and doesn't consent, no one in the United States would coerce him, even if he himself would die, certainly if someone else would die. But halachically, life takes precedence over autonomy, and sometimes we coerce. We have cases where we coerce someone to undergo amputation of a gangrenous leg. He refused. He was fully competent, but he didn't want the operation. It was clear that he's going to die from the gangrenous leg, from the infection, and by amputating, he can live many years. So it's a real life-saving procedure. And the Israeli law has a paragraph that allows a certain committee to do it forcefully, and indeed we did it. And by the way, the several people that we did it subsequently thanked us that we saved their lives. So to take by face value that he says no in the beginning, sometimes it's not very, very reliable, and you don't go into depths and you say, well, autonomously, he said no, we can't do anything. And I think that halachically, it should be done. Practically speaking, I don't know if legally, even in Israel, you can coerce someone to donate blood. So even if halachically you would be allowed to do it or even obligated to do, maybe legally you shouldn't do it. I'm not sure what the law here is. In the United States, certainly you can't do it legally.
Thank you. And we have questions from a Dr. Reese and then Dina.
So thank you very much, Rabbi Steinberg. I just wanted to know if obviously there are finite resources in the world, and if we have everyone staying on respirators until they achieve cardiac arrest, there will be scenarios where, let's say, a younger patient came in requiring the ventilator, and they would have a greater chance of surviving, as opposed to this person who we're waiting for them to just have a cardiac arrest. So I don't know, is there a way of hurrying them along because you haven't got any respirators left, and this person's got a chance of survival, whereas the person on the respirator hasn't? We're just waiting for them to arrest.
Okay, so if you're talking about shortage of respirators, that's one issue, but you can also talk about shortage of ICU beds. He's occupying an ICU bed as well. So as far as the ICU bed, even Rabbi Elyashiv agreed that a person that is brain dead and is just waiting for cardiac arrest, you don't have to keep him in an ICU. You can take him down to internal medicine or subunit, and you can free the bed for someone who is really in need, because in priority decisions, halachically, he has less priority than someone else. So you're not killing him although from those who accept brain death, he's dead. But according to those who don't accept, he's still alive, so you're not killing him. But there are priority for the scarce resource of a bed. Now you're asking about the scarce resource of the respirator himself. So if we could take him off the respirator, we can save someone else. And now that he's on the respirator, we can't save someone else. That would be true for any dying patient, even if he's not brain dead yet. You can say the same. He will be brain dead in 2 days. Why keep him on a respirator? Give the respirator to someone who has greater chances to live. The rule is, ein dochin nefesh mipnei nefesh. You can't kill one in order to save someone else. Even if you're killing one, that anyway will die. But at the moment he is alive and you can't kill him. So if according to those who don't accept brain death and they feel that he's still alive, you can't take him off the respirator to give it to someone else. There's a minority opinion that says that in extreme situations you're allowed to do it, but most poskim disagree. But practically speaking, if we go according to what I heard from Rabbi Elyashiv, that it's only to keep on a respirator, our experience is that such people, I don't know if to say die, because in my opinion, he's already dead. You can't die twice. But at least cardiac arrest will occur within 24, 48 hours. Usually they don't survive longer than that. So that is not such a big price to pay, because in most hospitals there are enough respirators for the few days to take care of it. In the COVID disaster, there were more problems, but usually in normal circumstances, it doesn't create any problem.
A question we received, maybe I should pause and ask the Rav Professor how much time you have, because they keep pouring in and we want to be respectful of your time.
I have 15 minutes until 8.
Perfect. Thank you so much. A
8
question
hour time.
a question that I think that dovetails nicely that we received on that discussion is, the Rav didn't mention this, but the idea of starting a ventilator on a timer, which to my understanding is an idea that never actually happened. But someone has asked what your opinion is on the idea. And
so I think that it should be done, and it's halachically acceptable. Not everyone agrees. Again, everything that I say, there are some who say the opposite. So don't take it by face value that I said, because everything is debatable. But many of the poskim, including Rav Waldenberg, who was of the opinion that you have to do everything to prolong every life, yet if you put it on a timer prior to the intubation, so the meaning of the intubation, it was already, then it's similar to Shabbos clock that you're allowed to put on the Shabbos clock on Friday, although by your act, by Groma, you're causing the light to go on and off. Yet it is permissible because it was done at a time where it was permissible to do, and at the time where it operates, you don't do anything, you don't do any act. So that is the assumption for a Shabbos clock, although even that not everyone agrees. And Rav Moshe has a tshuva saying that if he would have been at the time where they started it, he would answer it. But since everyone does it already, so he doesn't want to say anything about that. But most poskim accept it that's okay. So a timer on a respirator can be the same concept, that you put the person on a respirator with a timer that will stop the respirator automatically, let's say after 5 days. And in the meantime, you can evaluate the patient and decide if you let the timer run or you stop it because he improved or whatever. The problem with it is a technical problem, because every ventilator is built in a way that if there's shortage of electricity, it restarts itself, because otherwise, imagine that that there is a shortage of electricity, all the respirator-dependent patients will die because it will stop, right? So it's technically a little bit complicated to do. Nowadays, we know how to do it. The problem is in Israel, I don't know in the world, it's expensive to do it, and most respirator companies feel that there will be no market for it, because how many will want in the United States, you're allowed to withdraw, so why play with a timer? You just withdraw and that's it. So for a few in Israel that are not allowing to withdraw, for that, it doesn't pay to invest so much. That's the official stand of the companies. And also from a IRB point of view, you need a consent. Now, if you do it to a patient who is on a respirator, unconscious, how can you get a consent from him to put him on a timer? That's problematic. I thought that you can ask everyone prior, when he's still healthy and well, that if it happens that you'll be on a respirator and unconscious, would you let us do the experiment to see if the timer works well or not? I think there are solutions, but at the moment, it doesn't work.
Thank you. And Dina, I'm sorry I had asked you to speak and then flew right past, so please ask away.
Yeah, it's all good. My question is actually in relation to consent, which is perfectly timed at this point. And so there's a trend in the US of families who do not want to have the establishment of brain death, who refuse for the brain death exam or for the apnea test. And there's been a lot of debate in the bioethics community about whether or not consent is required. And so since you're talking about consent and coercion and some of these very difficult topics, I'm wondering if that happens in Israel, and how in this context, we handle those situations when families do not consent to brain death exam or to apnea testing.
Right. So there is the theoretical or the ethical approach and the practical approach. From a theoretical point of view, you don't need consent to do brain death testing, because it's like another procedure. You don't ask for procedures that are non-invasive and non-damaging. You don't need a consent. You do whatever you need to do for the patient's good. It's a medical procedure. So by law, you're allowed to do it without asking anyone. However, from a practical point of view, there are some families who are so adamant against brain death that it creates a fight. And if you know a priori that even if you'll establish brain death, the family won't accept it and you'll have to keep the patient on a respirator, why do it? What do you gain by doing it? You don't gain anything. So many times we just forgo it.
Thank you. The Rebbe didn't really get into the idea of a goses, but one question, but it certainly is relevant. I think one question nowadays is, does the concept of a goses even exist, particularly for understanding that the whole point is that you shouldn't touch someone when they're dying, particularly now when many patients are full code. The moment they are almost certainly considered a goses, you're doing chest compressions. So I guess for patients who are full code, is there such a thing as a goses?
Well, so goses is a very difficult concept, because it's something that in modern medicine, it's very hard to establish when the person is really goses. There are treatments and there are ways to overcome certain situations. So what in the old days looked like a goses is not necessarily the situation today. Rabbi Shlomo Zalman was the only one of the poskim that invoked the issue of goses. And his position, which I didn't expand on because really other poskim did not accept it, his position was that a person that is diagnosed clinically as a brain-dead person is sofek goises, sofek meis. He is maybe already dead because he accepted brain death as brain death, not only respiratory, but the whole brain was important for him to diagnose death. So maybe really the whole brain is already dead, and to add to it, he's not breathing, so he's dead. But maybe parts of his brain are still alive, and therefore he is egoisis. Now, what did it cause as a trouble? Because egoisis, you're not allowed to move. And if you want to test to prove that indeed the whole brain is dead, you have to take him to the nuclear medicine or to the MRI, or you have to move him. And according to Shlomo Zalman's position, you can't move him because he's maybe goises. I asked him if you're allowed to touch a goises. That's a machloikes. You're not allowed to move, but some say you're not allowed even to touch, and some say that you're allowed. His position was that you're allowed to touch. And therefore, I asked him if he will do a transcranial Doppler, which is applying a sensor to the skull, and by Doppler technology, you can see if there is still blood flow or not. This is only touching, not moving the goises. Would it be permissible? And if we'll see that there's no blood flow to the brain, then the brain is dead. The brain can't survive without blood supply, right? So he said, yes, you're allowed to do it. But we're talking about 30 years or 25 years ago, and then transcranial Doppler was not a very reliable mechanism to prove that indeed there's no blood flow. And therefore he said it's useless. If you're not sure that it is reliable, why do it? So even if halachically you can do. So that is the issue of goises. However, according apparently to Reb Moshe, certainly to the chief rabbinate, a person that is diagnosed brain dead, even clinically, is dead. He's not a goises anymore. He is dead. And therefore, if you just want to confirm, you're allowed to move him, because you're allowed to move a dead person to make sure that he is dead. On the other side, for Aval Yashiv, he is alive like any other person. It's not even a sophagosis for him. He is alive until the heart will stop. So again, according to him, you can move him. You can do whatever you want because he didn't regard him as a goises. So goises is very hard to define. And Shlomo Zalman thought that this is the unusual case that you can define a goises, and therefore it complicated the situation.
Thank you. And looks like Dr. Goldstein had some, I'm going to just allow you to speak and share your points about the neurological. You're muted. You're on mute. There you
Hi. Okay. Thanks very much. A wonderful lecture as always. I'm concerned about this idea that the hypothalamus is not part of the brain, because yes, it does have hormonal function, but also has neurons such as those that are form tracts like the hypothalamic spinal tract. And I don't think it affects so much the organ donation debate, but I just think the nomenclature isn't so good. Like if we call it whole brain death, the whole brain isn't dead. The hypothalamus alive, or brain death. I like when we used to call it brain stem death, and I'm wondering if you would comment on that.
Right. I don't think that halachically the require, except for Shlomo Zalman, certainly for Aval Yashiv, whole brain, part of the brain, brainstem is irrelevant, as long as the heart is functioning, right? According to Shlomo Zalman, it has to be a whole brain death because he wanted to equate the situation of brain death to Hut HaZarosh. Hut HaZarosh is a Mishnah that says that Hut HaZarosh metame be'ol, the moment that the head was decapitated, the person is already metame, which means that he is dead. So that is a Mishnah that tells you how to define death, and it doesn't mention the heart at all. It doesn't say the heart may be still functioning. As we showed with the sheep experiment, the heart was still functioning despite the fact that the head was decapitated. So to him, potential decapitation is that the whole brain is not functioning anymore. So for him, the whole brain per se was part of the criteria. For Moshe, for the chief rabbinate, for Avad Yosef, Rav Sternbuch, and others, breathing is what counts. So those parts in the brain that are responsible or take part in breathing, those have to be totally dead. Any other parts of the brain, if there is here and there a cell that is alive, that is irrelevant for the definition the way some define death. And therefore, even if we include the hypothalamus within the brain, which the major part of it is really not brain, but even if we include it and there are some neuronal functioning there, and this is still alive, or even if you'll find a few cells alive in the cortex and it's not really everything dead, I don't see the relevance to the definition if we define it this way that I presented.
Thank you so much. I want to be respectful to Professor Steinberg's time, and I don't see a greater discussion to end on than a neurologist to neurologist medical halacha debate on a chat like this. So I apologize if there are a couple of questions that we didn't have a chance to get to. If you send them to me by email, I will try to, if it's okay with you, Professor, I'll try to have them maybe sent and we can give people the answers they looked for. And thank you very much.
Thank you.
Yeah, and really on behalf of everybody, the Jewish Physicians Network and the Ematai, thank you so much for your generosity with your time, as well as the clarity that you brought to this, painful but very relevant subject for everybody. Thank you so much.
Thank you.